Welcome to the orientation class for total hip and knee replacement. I'm Caroline Bean, your nurse presenter, and today we'll cover everything you need to know to prepare for your surgery and recovery. This presentation was updated in June 2026. Our goals today are to help you learn how to prepare for your surgery, understand what to expect during your hospital stay and after you go home, and know what recovery looks like after surgery. Let's talk about the important role of your caregiver or coach. They will help with transportation to follow-up visits and physical therapy, and reinforce safety and teaching to support your recovery. Planning for your return home is key. Prepare meals ahead, identify your caregiver or coach. This could be one or several people, to assist with transportation and check-ins. Make your home safer by removing rugs and cords, adding night lights especially between your bed and bathroom, and consider staying on the main floor if you have multiple levels. Also, arrange help with pets and household chores since you shouldn't lift more than 10 pounds initially. Before surgery, physical therapy or prehab is highly recommended. 1 or 2 visits with your outpatient PT can help you practice stair training, learn to use a rolling walker, prepare your home, and practice safe car transfers. Strengthening exercises for your hip or knee before surgery will aid your recovery. You can start exercises from your patient booklet, doing them 3 times a day with 10 repetitions each, but avoid anything that causes too much pain. Make sure to see your primary care provider within 30 days before surgery, ideally 15 to 30 days prior, and any specialists within 3 months for clearance. Dental clearance is also required within 12 months, except for those with full dentures, who do not need clearance. To prevent infection, you'll need to apply mupirocin ointment inside your nostrils twice a day for 5 days before surgery, with the last dose the night before. Use just enough ointment on a cotton swab to cover the front of each nostril and press your nose sides together to spread it. Stop if you experience any irritation and contact your Joint Academy coordinator. You'll get this medication at your pharmacy about 2 weeks before surgery, with a MyChart notification when it's ready. You'll also use Hibaclin's wash for preoperative cleansing. Buy it locally or online and take 3 showers with it starting 2 days before surgery. Be sure to follow the provided showering instructions carefully. Seven days before surgery, stop taking any herbal medications and NSAIDs like Advil, Aleve, Motrin, and others. You can continue vitamin D, calcium, and iron, and all other prescription meds unless your doctor says otherwise. Blood thinners like Xarelto or Coumadin should be managed as per your physician's instructions. If you take a weekly GLP-1 agonist medication, hold it for 1 week before surgery. Daily GLP-1 agonists should be held the day of surgery. This includes medications like Trulicity, Bydureon, Ozempic, and others listed in your instructions. Acetaminophen, or Tylenol, is safe to take before surgery, so you can continue using it as needed. On the day of surgery, don't eat or drink after midnight except for 20 ounces of clear liquids up to 3 hours before your surgery time. Clear liquids include water, apple juice, Gatorade, coffee, and tea, but avoid milk, cream, honey, alcohol, mints, gum, and no purple or red liquids. Gatorade is encouraged for extra carbohydrates and electrolytes. Bring your photo ID and insurance cards, wear loose clothing and flat, closed-back shoes. Bring dentures, hearing aids, glasses, and your CPAP machine if you use one. Also bring a list of your medications, but only bring the actual meds if told to and in their original bottles. Leave valuables at home. Plan to arrive at least 2 hours before your scheduled surgery. Park in the visitor lot near the main entrance and check in at the admitting desk on the right. An admitting counselor will help with your forms, then you'll go to the preoperative area for final preparations. In the preoperative area, you'll change into a gown, and the nurse will review your medications and start pain management with medications like Celebrex, Lyrica or gabapentin, Tylenol, and possibly a long-acting narcotic. You'll meet the anesthesiologist to discuss anesthesia options, usually spinal or epidural, which will keep you comfortable and help with quicker recovery. The surgeon will mark the operative leg and answer any last questions. We use a pain scale from 0, meaning no pain, to 10, the worst pain you've ever had. Nurses will check your pain levels before and after surgery to manage your comfort. The operating room can feel cold and busy with many people and supplies. Surgery usually lasts about 2 hours. Your surgeon may inject numbing medication around your joint to help with pain during surgery. After surgery, you'll spend at least 2 to 4 hours in the recovery room, or PACU. You'll have IV fluids, continuous heart monitoring, and ongoing pain management. Let your nurse know if your pain increases so they can give you medication. Nausea medicine will be given if needed. Once you're stable, you'll either go home or to your inpatient room. Some patients are pre-approved for a one-night hospital stay, with additional days only if medically necessary. Others are scheduled as outpatients and will leave the same day once recovered from anesthesia. Check with your surgeon to know your status. Our goal is early walking after surgery, ideally within 4 hours once anesthesia wears off. Early ambulation is key to a successful recovery. In the recovery room, once you can feel and move your leg, usually 2 to 4 hours after surgery, the nurse will help you sit on the bed's edge. If you feel okay, physical therapy will come to help you stand, walk to the bathroom, practice stairs if you have them, and teach exercises. It's important your care partner is present since you might be too groggy to remember everything. If you're staying overnight, you'll have your first physical therapy session the day of surgery if recovered by 5 p.m. If not, nursing staff can help you out of bed. The next morning, expect PT and OT around 8 to 10 a.m., and your care partner should be there especially for stair training. The goal is to be ready to go home after PT, usually between 10 and 11 a.m. If you need a walker, we'll provide one during your hospital stay. If home physical therapy is recommended before outpatient PT, we'll arrange that for you. Home PT usually happens 3 times a week for 2 weeks before starting outpatient therapy. Since outpatient clinics can have wait lists, schedule your appointment 2 to 3 days after surgery before your surgery date. If you start home PT, you can reschedule outpatient PT for 2 weeks later. Dr. Nichols' hip replacement patients typically do not require physical therapy after surgery. Instead, they receive home exercises and are encouraged to walk around every hour during the day. For physical therapy, wear comfortable clothing. Total knee patients should wear shorts or wide-legged pants to accommodate bulky dressings and allow the therapist to assess knee bending. Total hip patients should wear loose-fitting clothes like shorts or pants. Choose shoes that fit well and won't slip off, such as tennis shoes with rubber soles. Avoid flip-flops or slippers. If you stay overnight, you'll be on the Joint Academy Surgery Unit, where nurses will orient you to your room and check on you every 2 hours. You'll have a call bell for assistance between rounds, and nursing staff will manage your pain throughout your stay. All our patient rooms are private and include private bathrooms to ensure your comfort and privacy during your stay. Our inpatient goals include walking to the bathroom with staff assistance, no bedpans or urinals unless medically necessary. Even if you have pain, getting up helps reduce stiffness. Always call nursing before walking and aim to be in a chair for meals and dressed by early morning with nursing help. Pain management continues with scheduled medications like Tylenol, Celebrex, and gabapentin or Lyrica for patients under 75. Narcotics are available as needed, usually every 4 hours. Notify your nurse if pain increases. At home, track your medication times and never adjust your pain regimen without your surgeon's approval. Staying hydrated is critical. Aim to drink at least 64 ounces of water daily unless your doctor advises otherwise. Dehydration can cause low blood pressure, dizziness, fatigue, and muscle cramps after surgery. Blood clots are a risk for the first 30 days post-surgery in both legs. Watch for signs like redness, warmth, tenderness, or swelling in your calf. Prevent clots by walking frequently, taking blood thinners as prescribed, and using a DVT pump if recommended. Blood thinners you might take include aspirin, Xarelto, Eliquis, or Lovenox injections. These help prevent clots and should be taken exactly as prescribed for 30 days after surgery. Some medications can be costly, so check with your insurance or pharmacy about copayments. Remember to keep moving while on these medications. At discharge, you may be given a DVT pump to use at home. While your surgeon recommends it, the choice is yours. It can cost up to $150 out of pocket, but insurance may cover part of it. There's a video available to show you how to use it. The DVT pump should be used anytime you're sitting, resting, or lying down, including while sleeping, especially during the first 10 days after surgery. Using it for 6 to 18 hours daily has been shown to reduce clot risk. Your risk depends on your surgery and health, so follow your provider's instructions for how long to use it, often at least a month. You'll be provided a rolling walker at discharge. If you already have one, bring it so physical therapy can adjust it to the correct height for you. Some equipment is not covered by insurance but can be purchased or borrowed. Items like single-point canes, raised toilet seats, shower chairs, and other aids can be found at drugstores, online, or through medical device loan closets in Maryland. If you have stairs at home, getting a single-point cane before surgery can help with mobility and safety. A raised toilet seat or bedside commode makes it easier to get up from the bathroom and maintain independence. When using a bedside commode, remove the bucket and place the device over your toilet seat. A shower chair is helpful, especially if you're having two joints replaced at once, to make bathing safer and more comfortable. Additional helpful tools include a hip or knee replacement kit with items like a sock aid, long-handled sponge, grabber, and shoe horn to assist with daily activities. A leg lifter can help you move your leg, when getting in and out of bed or chairs, making transfers easier during recovery. The hospital will provide an ice machine to help reduce swelling and pain after surgery. When using the Breg Polar Care ice system, never apply the pad directly to your skin. Always place a towel or clothing between the pad and skin, check your skin often, and stop if you notice any blistering. Use the machine several times a day for about 20 minutes on and 20 minutes off. Remove it when walking, exercising, using the bathroom, or showering. Ideally, use it for 4 weeks after surgery. Your post-operative bandage is a Mepiplex dressing that is water-resistant but not waterproof. You can shower 3 days after surgery, but check your discharge instructions for the exact date. You'll remove the bandage on day 7 after surgery, following the instructions given. Your incision may be closed with dissolvable stitches and surgical glue, which usually dissolve within 6 to 8 weeks, or staples. If you have staples, be sure to follow up with your surgeon for removal within 2 to 3 weeks after surgery. Do not apply lotions, ointments, or creams to your incision until it is fully healed, usually around 8 weeks when there are no scabs or openings. Avoid submerging the incision in water like baths or pools. You can shower, but don't scrub the area. Let soap and water run over it and pat dry gently. Never pick at scabs or remove sutures yourself. They will fall off naturally. For knee replacements, keep your knee straight when resting to prevent scar tissue. Elevate your leg with rolled towels or pillows under your ankle or foot. When walking and exercising, you can bend and extend your leg normally. Hip precautions vary by surgeon based on the procedure performed. Physical therapy will review these with you and provide a handout on positions to avoid before discharge. After surgery, bruising and swelling from your hip to your toes is common and can last 6 to 8 weeks. Everyone heals differently, so expect some variation. Icing and elevating your leg will help reduce swelling and pain. Call your doctor if you have a fever over 101.5 degrees, increasing redness, drainage, or swelling at your wound, or if the drainage is yellow or foul smelling. Also call if you have calf pain, tightness, redness, or swelling. Call 911 immediately if you experience shortness of breath or chest pain. After surgery, stay hydrated and eat a regular diet with increased protein to support healing. You can boost protein through food or shakes, choosing options that are high in protein and low in sugar. You can usually start driving about 4 weeks after surgery once cleared by your provider or physical therapist. Sports can be resumed gradually around 2 months after surgery, and hobbies as you feel able. Follow up with your surgeon as directed in your discharge instructions, usually 2 to 4 weeks after surgery. Also see your primary care provider for any infections like urinary tract or sinus infections. There are helpful videos available online for going up and down stairs, home exercise programs, knee exercises, and hip exercises. Access codes are provided to help you find these resources. Here's an example of normal bandages and incisions after surgery to help you know what to expect. This slide shows healing 4 weeks after surgery as an example of what your incision might look like during recovery. Howard County Department of Aging offers resources for home. Thank you for joining this orientation. We hope this information helps you feel prepared and confident for your surgery and recovery.